Hi, I'm Annie Leong, Palliative Care Nurse Consultant for the Northeast. Thank you for taking this time to join me in this webinar presentation on fatigue. The PowerPoints for this presentation are by the courtesy of Kath, who is the author of this textbook, Integrating a Palliative Approach, Essentials for Personal Support Workers. At the end of this webinar, it's my hope that you will be able to, firstly, understand the term fatigue. Why fatigue, unlike in a healthy person, is a very different experience for a person who is dying. Next is that you will be able to recognize the signs of fatigue in a person who is experiencing a progressive and life-limiting illness. That you will understand your role as a personal support worker in information gathering by using assessment tools to record and to report your observations of the person's changing condition to the care team. And thirdly, that you will be able to work with the care team to adapt a care plan by individualizing comfort measures that take into consideration of a preventive approach to manage the symptom of fatigue that also include the support of the person in the moment at the time of their needs, as well as to support the family. We talk about how fatigue can feel different for individuals in that a healthy person generally feels fatigue after having expended energy, such as taking a walking exercise or a running exercise. Whereas for a person with progressive life-limiting illness, the person may feel fatigue without having consciously used any energy. Like pain and most other symptoms, fatigue is a subjective symptom. The person may describe feeling tired to feeling exhausted with any seemingly minor activity or even with non-activity. This symptom of fatigue without any physical exertion is often an early sign of illness, which usually becomes more significant as the person's disease progresses, and certainly more so as the person approaches end of life as part of the normal physical changes of the dying process. So question is, what else can cause fatigue? Fatigue in a palliative setting is the most common and debilitating symptom in people with advanced cancer or chronic diseases such as heart failure or COPD or kidney failure. The medication or treatment used to treat the person's underlying disease, example chemotherapy or radiotherapy, can also cause or worsen the symptom of fatigue. Decreased intake and weight loss, as in a setting of an advanced disease progression, can also lead to the person experiencing reduced energy. Physical factors such as stress, sleep disturbances or pain, or other psychological factors such as depression, fear, and anxiety can in one way or another result in poor energy. We talk about how personal support workers play an important role in information gathering. So in the next couple of slides, let's look at how you may recognize the signs of fatigue in a person who is experiencing progressive life-limiting illnesses by making observation, by asking questions to identify the symptom of fatigue. The key note here in your observation is to be alert. Be alert for the signs of fatigue that can be non-activity related, in that you'll find a person is now unable to complete their ADLs and their other usual tasks such as bathing or cooking or dressing, all of which can seem exhausting and overwhelming for the person. The person may have slept or rested for more than their usual and yet would still feel unenergized. And the person may be expressing to you, I'm still feeling so tired. Or you find that the person is easily distressed even with any relatively minor activities. The person may be withdrawing from or lost interest, for example, in social activities, perhaps refusing to see visitors. So you see here how fatigue may not only interfere with the person's physical function, but also it can impact the person's social well-being and their overall quality of life. This can lead to significant distress for both the patient and family. Good assessment involves teamwork. As part of the care team, personal support workers may gather information by using assessment tools such as the list of sample questions to create questions that will help to explore what you have observed and to identify the symptom of fatigue and report it to the nurse. The person's response to your questions will help you and the care team to individualize comfort measures that will meet the person's changing needs. You may begin with questions relating to the symptom onset, for example. When did a person start to feel fatigue? How long does it last? How often does it occur? Next, what makes it worse or what makes it better? This will help you to identify what brings on the symptom of fatigue and what may help to relieve the symptom. You may ask the person to describe what does it feel like with the symptom. Next, does the person has any other symptoms that may be contributing to the fatigue? For example, if the person has an underlying COPD, you may ask if there's any increased shortness of breath that is other than the person's usual, which may then be causing the person to feel overly anxious or to have difficulty with sleep, all of which in a long stretch may lead to the person experiencing poor energy. You may ask, how is the person bothered by the symptom? That is, how is the symptom of fatigue affecting the person's physical ability to function and their overall quality of life? Lastly, and most importantly, asking what you can do to be helpful to support the person better cope with this debilitating symptom. The information you have gathered and reported to the nurse will then allow the care team to adapt a care plan that will meet the person's changing needs. So in the next few slides, we will look at how we may individualize comfort measures by looking at the preventative measures, how we can support the person in the moment, as well as how we may support the family as a unit of care. Although fatigue can be very distressing for the person who's ill or dying, we want to be sure not to overlook the symptom, especially while the care team is managing the other more obvious symptoms such as pain or nausea or delirium. Personal support workers provide comfort measures by asking and listening to the person and family talk about their experience of fatigue. This way, you may then acknowledge their reality of fatigue as you bear witness to their frustrations and to the sense of limitations in what the person can do or cannot do. You would also want to be mindful of the person's poor energy level. So, when providing care, you may want to conduct your approach in a quiet, gentle, and positive manner rather than being overly energetic and enthusiastic in your conversation. By preventing fatigue, you are providing supportive care. Personal support workers can prevent fatigue by helping the person with their ADLs and transfers so as to allow more energy for things that are most important for the person. You may assist the person to pace their activities for the day, such that there's a balance between activities and rest. You may suggest activities for when the person's energy levels are at its best. For example, if the person seems to have more energy in the morning and appears more tired and wants to sleep in the afternoon, you may ask, do you want your family to visit you in the morning instead? Or you may ask the person if they would like to limit the number of visitors or the length of visits. You may encourage exercise early in the disease process. Mild exercises like walking short distance can be a way to increase energy. Exercises in the later stage of the person's disease progression, however, may add to the physical exhaustion. To help the person maintain their limited energy, the key here is being flexible. Being flexible when you're providing care. For example, if necessary, to reschedule treatments and activities if the person is not up to par. Identifying comfort strategies may mean allowing the person to choose between having the energy to walk to the dining room or having the energy for their meals. In this case, using the wheelchair to get the person to the dining hall may help to maintain the person's limited energy. If not, you may offer a person a meal in the bed if they like, or offer a small snack rather than a full meal. You may suggest some activities that will help the person feel more relaxed while being mindful of the person's choice and preference. Example, if they would like to listen to music or would they prefer to watch TV. If the person is experiencing disturbed sleep, you may suggest options that can help to improve sleep, such as some quiet time before bed, lowering the noise down, or turning down the lights. Or if the person would prefer to receive some therapeutic touch, if this is available. Personal support workers may support the family by helping them to understand the changing energy levels of their loved one who is dying. Being directly involved with the person and family, you may be in a position to work with the family to plan appropriate activities and caregiving tasks that will meet both the needs of the person and family. For example, by prioritizing activities that are meaningful and giving themselves permission to take a less active role, for example, in housework, or offering the family opportunities to assist with a person's ADLs can be helpful for some family caregivers. You want to be available to listen and acknowledge their fears and concerns about what fatigue might mean for the person and the family caregiver. You want to report that concerns to the nurse. For example, if they're feeling that fatigue is caused by the medications given. In this case, you can help to reinforce education, which were provided in a family brochure or by the care team. You may explain that drowsiness is a normal side effect of opioids, particularly when the person is new to the opioids that was started or if the dose was being increased. This drowsiness, however, will fade away a few days later. However, when a person is nearing death, it is normal and expected that the person will become weaker and sleep more and more. Along with the comfort measures which you provide, the care team may also consider treatments that will help to remove the underlying cause or causes of the person's fatigue. For example, providing blood transfusion if the person has got underlying anemia that is contributing to the symptom of fatigue, or treatments such as antibiotics to treat infection. When all possible treatments fail, a short course of steroid can help to boost the person's energy level. This medication has also other added benefits such as improving the person's appetite and overall sense of well-being. This option is most helpful when the person's goal, for example, is to be able to participate in certain activities or events, such as upcoming wedding of their daughter or a birth of a grandchild. When a person's fatigue is so great that the person is confined to bed, however, steroid medications may no longer be effective and may be discontinued. In summary, we have discussed how fatigue in a dying person is different than in a person who is generally healthy. Fatigue without physical exertion is often an early sign of illness, and this often becomes more significant as the person's disease progresses. You want to be alert for the sign of fatigue, which may be overlooked amongst the other more obvious symptoms, such as pain or nausea. Personal support workers may adapt the list of questions to gather information, record and report to the care team. This information which you have gathered may help the care team to develop a care plan to meet the person's changing care needs and also to individualize comfort measures to support the person by using preventive approach as well as meeting the needs of the person in the moment and including support for the family. Once again, I thank you for your time. I hope this information will enable you to provide good and supportive care for the person who is experiencing fatigue and including the family. If you have any questions, you may contact the palliative care nurse consultant in your area, or for more information, you may also visit the website Life and Death Matters. Thank you.